Welcome back to KTN Prime. I'm Robinson Okenye. Now, just a day after armed mob invaded Kitengela subcounty hospital in Kajiado County, disrupting a cesarean section, tension still remains high at the facility as its healthcare workers grapple with the terrifying events that saw some of them sexually assaulted. In the following exclusive interview, KTN brings to the fore the chilling 4-hour ordeal of a hospital under the capture of goons through the lenses of a doctor who braved the terrifying moment to save a mother and an unborn child. Here's Gloria Milimu.
The atmosphere at Kitengela Sub-County Hospital remains tense. Although normalcy seems to have returned, the chilling events of Monday afternoon continue to plague victims of the chaos that saw goons in their hundreds storm the facility, leaving both patients and healthcare workers in disarray. At the facility, we meet Dr. Sara Rashid, a medic whose fortitude helped save the life of a mother and her unborn child during an emergency cesarean section that was disrupted by goons who had taken over the facility, unleashing terror on both patients and healthcare workers.
You could see them holding their sticks and their clubs and the stones. So most of us from the OPD department started running down into the hospital so that they could save themselves from these goons.
She tells KTN that the attack quickly morphed into a crisis that grounded services at the facility, including the theater where she was helping bring forth a child. The traumatizing events, she says, threw her colleague off balance, disorienting her and leaving her in shock. However, it was imperative that she stayed calm and collected in order to finish the procedure that took at least 45 minutes in order to ensure that her patient on the operating table came out alive.
So unfortunately, we were there in our tense in the very tense atmosphere with all of us. We had tachycardia of I don't know how much.
And as the terrifying scene unfolded, Dr. Rashid and her colleagues were yet again confronted with another emergency. Barely had she finished suturing the CS patient, she was also forced to step in and help save another life. This time, the life of one of their tormentors who had sustained a deep cut that had left him bleeding profusely. The goon is said to have injured his hand after punching a glass on a window he was trying to break into.
While we were doing our procedures and making sure he was stabilizing, he started going into shock. So we gave him his blood transfusion and he was admitted into the ward.
KTN was also informed of shocking details of goons who had sexually assaulted some of the nurses before harassing them to conduct certain procedures that were not viable. They were then forced to flee for safety and even disguise as patients by donning hospital gowns. Under international law, hospitals are protected places. They provide more than care in communities they serve. And when attacks such as the one that was witnessed here at the Kitengela Sub-County Hospital happen, they not only jeopardize the safety of healthcare professionals, but also hinder access to quality care. The World Health Organization says that in 2023 alone, at least 1,520 attacks on healthcare were reported. This resulted in the deaths of at least 750 patients and healthcare workers and 1,250 injuries.
We still feel like when you hear a sudden noise and you're like, okay, what's going on? What's that? Because it was not something that we ever expected.
Experts say providing occupational health and safety measures for protecting healthcare workers is fundamental for well-functioning and resilient health systems. Therefore, it is paramount for the government to ensure the safety of these frontline workers in order to ensure continuity of service delivery. Gloria Milimu, KTN.
Drama erupted today